Hello and welcome to today's presentation on lymphatic massage after liposuction. My name is Kathleen Lisson. I am board certified in therapeutic massage and bodywork. I'm a lymphedema therapist. I'm one of the co-authors of the Standard of Care for Lipedema in the United States, and I'm the author of the Plastic Surgery Recovery Handbook and the Lipedema Treatment Guide. Today, we're going to talk about why your surgeon recommends lymphatic massage after your liposuction. So, your surgeon can recommend lymphatic massage after your liposuction because there's research out there where their colleagues are stating that they use lymphatic massage for the postoperative protocol for several different types of liposuction. So I put a few research articles here. They may be reading this article on high definition liposculpture for males. They may be reading the article on liposuction body contouring, the one on Vaser and Renuvion, large volume liposuction, and lastly, liposuction for lipedema. And if you have lipedema and you're getting liposuction, stay tuned to this presentation. I will show several slides on how you can get ready for your liposuction surgery. They may also be influenced by their board. The American Society of Plastic Surgeons lists lymphatic massage as one of their 8 ways to make liposuction recovery a breeze. So let's look at more about what is manual lymphatic drainage. So lymphatic massage or manual lymphatic drainage is a cornerstone of non-surgical lymphedema management. And it is also gaining prominence as a supportive therapy in plastic and reconstructive surgery. So what is lymphatic massage? So MLD is a specialized massage technique, and it employs slow rhythmic hand movements to stimulate lymphatic flow and reroute lymph through functioning channels, particularly after surgical disruption. So this is a type of massage. It's different from the Swedish massage that you would get when you go for a relaxation massage. So it's definitely a specialized type of massage. We can use a few different words to describe it: Vader style manual lymphatic drainage. Some people will just use the initials MLD. Some people will say lymphatic massage when they're describing it. But basically what it is it's a little bit different to other styles of massage. We use a different speed. It's slow. We use rhythmic hand movements and a certain amount of pressure on the skin. So it's not going to be a deep tissue massage. We're massaging the skin and some superficial tissues. And it's also, the massage is in a different particular direction and a particular order. And we'll look at those two in some future slides. But how does MLD help? So why are we getting this type of massage versus perhaps another type of massage or no massage? So manual lymphatic drainage can help to boost vessel contractility. It may stimulate lymphatic vessels, which is increasing their contraction to help keep that lymph flowing optimally. So again, it's this gentle skin stretching stroke that is going to stimulate the lymphatic vessels to increase contractions and move the lymphatic fluid through the system. It can also reduce lymphatic pressure, so it can help lower pressure in distal areas, which can reduce the discomfort. Sometimes having a lot of swelling is very uncomfortable. It can also enhance fluid reabsorption. That's really what we want to do. There's extra fluid, there's extra swelling after your liposuction surgery. And by gently elevating the interstitial pressure through the pressure we're putting onto your body through the massage, more fluid is going to be reabsorbed into the body's lymphatic system. So let's now get to that direction and order, these final 2 parts of what makes lymphatic massage different from other types of massage. We're following a specific map. We understand how the lymphatic system works. It carries the lymphatic fluid in certain directions to the lymph nodes and then carries it through the body to the circulation, the venous circulation, and then this fluid eventually goes to the bladder, the kidneys, and you urinate it out. So this is the lymphatic drainage map. And if you haven't had any cuts on your body, this is the map that your therapist is following. So the massage is in a particular direction. And the massage is also in a particular order. So you're going to see the massage start closer to a lymph node and then move its way to the area of swelling, because what we're doing is trying to get this traffic jam moving again. So you see this traffic jam on the screen. That is kind of what is happening to your body after surgery. There's a whole lot of swelling. It all wants to get into the lymphatic system. It may be there's swelling in the lymphatic system, and we need to get that system moving more optimally. So thinking of a traffic jam, where do you have to move cars first? You can't just move at the end of the traffic jam. You can't just start trying to move your car faster, because all these cars are ahead of you. You have to get the cars at the beginning of the traffic jam to move faster, so there's room for the rest of the cars to move too. So that's why your lymphatic massage doesn't necessarily start right at the area where you had your surgery. We're not starting at the hands or the feet. We're trying to get that traffic jam moving again by helping the lymphatic system move from right near the lymph nodes. Okay, so what we're doing, the purpose of lymphatic massage is edema management. And we see research on this. Edema is treated with a combination of lymphatic massage, compression, exercise, and skincare. So lymphatic massage is a gentle touch. It is encouraging lymph flow, which may reduce swelling. Your compression therapy after liposuction, your surgeon will give you a garment to wear. These special garments will help control swelling and inflammation. They're part of the edema management. Exercise, this body movement is also going to be helping. I'm not talking about you running a 5K the week after your surgery. Just this light movement, your surgeon may talk to you about walking, ambulating, and light movement can help boost circulation, which is going to help the fluid move more effectively, because it's going to activate your muscles, and your muscles activation can help to move the lymphatic fluid in the lymphatic system that's inside of your muscles and deeper in your body. And it's also very important to understand that your skincare routine is part of your edema management. Proper skincare will support your healing, and it will reduce the risk of issues such as an infection. What we want is nice, healthy skin. That's your barrier for your immune system. If you get cuts, if your skin is too dry, if it's too delicate, if it opens up again, that is going to lengthen your time of recovery before you're fully healed. So let's turn to lipedema, specifically for people who are having liposuction and have a diagnosis of lipedema. So lipedema is a loose connective tissue disorder, and we're going to look at certain parts of the standard of care for lipedema in the United States. This document is available free full text online. You can go to PubMed. You can just search on the internet for standard of care for lipedema in the United States. It is free. The entire document should be free for you to read. I will give you information about this document at the end of the presentation. Let's look at some parts of it that are very important for you to understand if you have lipedema and you're seeking liposuction. So the first one is to understand that lipedema reduction surgery utilizes suction lipectomy, which may also be called liposuction. It may also involve excision and manual extraction. And this surgery, this liposuction surgery, should be sparing the blood and lymphatic vessels. So it has to be surgery that's safe for your veins. It's safe for your lymphatic vessels. Indications for lipedema reduction surgery. Why should you get it? You should have a diagnosis of lipedema, and you should be able to demonstrate that you're able to adhere to the conservative therapies. You've gone through conservative therapies, you understand them, you're able to do them. And even though either they're working, but you want to have the liposuction, or they're failing you, they're not good enough, you want to have better result than you're getting with just conservative therapy. But the one thing that is in common is you have done the conservative therapy. You understand what it is. You are capable of doing it because you're going to have to do your conservative therapy after your surgery. So lipedema liposuction is not a cure for lipedema. It is not going to take away all your symptoms. It is not going to take away your need to still do self-management for your lipedema, because it's not curing your lipedema. You will still have lipedema after this surgery. Women with lipedema should be treated with conservative therapy prior to your lipedema reduction therapy. So you should have conservative therapy leading up to your surgery. And the weeks before surgery, go to a certified lymphedema therapist. So I would say I absolutely do not recommend having lipedema liposuction unless you have a certified lymphedema therapist. Go and find the lymphedema therapist first, get the conservative therapy, and get that plan for you, your pre-op protocol, your post-op protocol, so you understand how you're going to self-manage both before and after your surgery. So the certified lymphedema therapist can perform a pre-surgical screening to guide your prehab exercise. They can also perform manual therapy and recommend compression garments for you. So when you walk into the day of your liposuction, you should already be optimized for this surgery and understanding what you have to do to take care of yourself afterwards. Post-surgical care should be performed by a certified lymphedema therapist 2 to 3 times a week, as soon after surgery as possible. So your surgeon will talk to you about when to start. And I would say do not stop until your swelling subsides. Understand that lipedema is going to take a longer time to heal from after liposuction than someone who just got cosmetic liposuction. This is not because you just don't like the look of your legs. It's not just a half a liter or a liter of liposuction. This is serious surgery, and it will have an extended recovery. So if you want more information about lipedema, if you want to share the information with your healthcare practitioners, I recommend that you read the standard of care for lipedema in the United States. It's available in free full text on the internet. You can also search by the PMID number right here. It is available for you and your medical professionals as a resource. Here are the resources that I used to make this presentation. And I'd like to thank you for listening to this short presentation. I hope I've given you some more information and understanding about the value of manual lymphatic drainage in your healing from your liposuction. I encourage you to follow me on Instagram at Kathleen Lisson and find more resources at KathleenHelenLisson.com. Thank you and have a great day.